And while the Liberals are questioning how many Conservative members have vaccine mandate exemptions to get back in the House, why does it matter so much? Well, let's find out. All right, joining me now is the government House Leader Mark Holland. Good to have you on the program, and everyone's back. Let's start with some, there's lots on the agenda, but you have had concerns about the number of Conservatives who say that they have a medical exemption. Are you now satisfied that the House has checked everyone and all MPs who are in the House today are either vaccinated or have a legitimate medical exemption?
Well, Evan, we know last week the Conservatives had a individual who tested positive for COVID. We don't know whether or not these unvaccinated members, and we don't know how many of these members were there or weren't there. And we still don't know, as I say, that number of unvaccinated members. Our concern is that a medical exemption should be something in the range of about 1 in 100,000. And so for there be multiple people who are potentially in the Conservative caucus unvaccinated, it just doesn't add up in terms of math. So we need to know that these medical exemptions are legitimate. And the Chief Medical Officer of Health and other medical officers of health have been very specific about what constitutes a legitimate vaccination. And this is a matter of public health.
Okay, but the Conservatives are saying you're casting doubt on the House of Commons is supposed to give them either the green light or not. So whether you know if someone's got a legit exemption or not, as I understand it, you correct me if I'm wrong, as I understand it, the Conservatives are saying we've submitted all our status to the Parliament, and they have decided that everyone either is double vaccinated or they have a legitimate medical exemption status. So are you questioning that Parliament has not done a thorough enough check of these medical exemptions?
No, what I'm saying is that right now we can't, the only thing that they can do is receive a letter saying that the person has a medical exemption. They can't know what the nature of that exemption is or whether or not it actually constitutes what the Chief Medical Officer of Health has said is a legitimate exemption. So they're just receiving a letter and they have no additional context.
What's your worry?
Which is why
I'm just trying, are you worried that someone's basically got a doctor to give them a medical exemption for something that's not legit?
We know that there are about 1 in 100,000 people who should have a legitimate medical exemption. That means in a caucus of 119, if you have multiple people, there's a better chance of the chair I'm sitting on turning into a tiger than that being the case, that you would have that many exemptions in a pool of such small number of people. So the problem
you think they're both? I just want to be clear. So you're saying your concern is bogus medical exemptions. Is that it?
My concern is that whatever exemption that they've been given is not actually a legitimate exemption as per the Chief Medical Officer of Health's definition of what should constitute an exemption. And I think that when we're talking about a workplace, we're talking about the House of Commons and the precinct as a workplace that staff work in, journalists work in, House administration work in, that MPs work in, that folks have to know that that workplace is safe. And right now, the numbers don't add up. They don't make sense. And, it's particularly unusual to me that the Conservatives won't even tell us how many folks aren't exempt, aren't vaccinated, that we don't even know what that number is. So, it's just very difficult to look at people in the eyes and tell them this is a safe place to work on the one hand, and on the other, the math just not add up.
Oh, okay.